All right, the last thing that we'll discuss today is communication skills and tools. This can be found on chapter 3, which starts on page 41 of your administrative dental assisting textbook. So the things that we'll go over in this chapter is we'll first identify the 5 elements of the communication process and what that looks like. We'll differentiate between verbal and nonverbal messages, including how the two are used to send and receive messages, and demonstrate how the dental healthcare team sends nonverbal cues. We'll categorize the different types of interpersonal communication and describe how they are used in the dental profession. We'll discuss the barriers to effective communication and express how members of the dental healthcare team can remove these barriers. We'll also describe how culture can be a barrier to effective communications and explain what a dental practice can do to minimize this barrier. We'll describe some of the techniques that should be used when communicating with patients who have a disability like a visual, hearing, speech, or cognitive disability. We'll list the responsibilities of the sender and receiver that contribute to effective communication, and we'll identify and describe professional telephone manners. So these are the elements of the communication process. The sender has an idea that must be shared with another person or group. The idea is then translated into a message. The message is placed on a medium or channel, and the medium is sent by various channels and is received by the receiver. Once the receiver receives the message, the receiver reacts to the message and provides feedback to let the sender know that they have received the message and to make sure that everybody's on the same page. There are different mediums of communication. There is verbal or spoken communication. This can be spoken or written. Nonverbal communication deals with tenseness. And tenseness can be expressed nonverbally in the way a patient sits. Tenseness can be seen in the reception area where patients anxiously wait to be called. They may sit with their legs tightly crossed and ankles wrapped. So this is one example of tenseness. Embarrassment can cause patients to cover their mouths. This may be because they have anterior teeth that are less than perfect. Anger, disapproval, or defensiveness can be deduced when patients cross their arms, clench their fists, and sit in a very tight manner. Nonverbal cues from the dental healthcare team that you can use to help with communication um, include smiles, touch, and sincerity. So caution should be taken to send only positive cues. Smiles always communicate a positive thought. Touch can convey a message of warmth, reassurance, understanding, and caring. So what I mean by touch, I mean like gently touching a patient's shoulder or touching their arm. This lets patients know that you care. Patients can recognize sincerity when members of the dental healthcare team remove barriers. Barriers can take the form of desks and other objects that come in between the team member and the patient. Interpersonal communication can include patient to dental healthcare team. This is when information is being sought in forms of questions, when directions are being given. This can be during telephone conversations or appointment scheduling. Interpersonal communication between the dental healthcare team to the patient includes planning treatment, making financial arrangements, scheduling appointments, giving oral instructions, answering questions, sharing information, motivating, and informing. Interpersonal communication from team member to team member includes directional communication, organizational, informational, professional, and personal communication. This can be talking about um, when they're asking questions about each other's family, or how's your mom doing, or did you have fun on your trip? That's what I mean by personal things. Professional to professional can deal with referrals, inquiries about a shared patient's chart, consultations, or directions. Here are some barriers to effective communication. Semantics is a change in the meaning of a word. So when semantics enters into the communication process, the meaning according to the sender may not be the same as that interpreted by the receiver. Jargon refers to specialized words, acronyms, and other sayings that is unique to a group of or a profession. The meaning of a message may be lost when the sender uses jargon that is unfamiliar to a receiver. So you never want to say certain things to the patient, like let's say, for example, the patient needs a mesial occlusal cavity on number 3. Well, first of all, patients don't even know what that means. So if you say something like, oh, you need an MO composite on tooth number 3, they're definitely not going to know what that acronym means. So you want to say something like you need a filling between the teeth on your upper right tooth, the third tooth in, just to make sure that they know exactly what it is that you're talking about or what it is that you want to do. Credibility is a weight that is put on a message according to the status or qualifications of the person who is sending the message. A major barrier to communication arises when preconceived ideas change or block the way a message is received. Information that has already been received and is considered true can block a message. For example, the patient with periodontal disease has come to believe that all adults will lose their teeth and will have to wear dentures. So when their teeth start becoming loose because the bone has deteriorated because of their periodontal disease, they may think that there is nothing wrong with it, that it is just part of the aging process. So that is a preconceived idea. Culture can present a barrier to communication when the sender and receiver do not have a common understanding. So these can be things like racial, religious, or social, or things like that. Um, so culture is passed down from generation to generation, and each culture can have many subcultures. And these beliefs and values form the way we think and behave. Patients with disabilities that experience communication barriers will require a different approach on how we communicate with them. Other barriers include emotions, stereotyping, noise, and conflicting interpretation. Emotions play an important role, or play an important role as barriers to communication when people are upset, angry, or even happy. They sometimes do not hear the message. Stereotyping blocks effective communication because assumptions are made about on the basis of non-factual information or preconceived ideas about a person, idea, or procedure. Uh, Noise may alter the message if the sender and the receiver cannot hear the message. Culture can present a barrier to communication when the sender and receiver do not have a common understanding. Like I said, culture is commonly defined as a group whose members share the same beliefs and values. And to overcome some of the cultural barriers, it may be necessary to have forms, documents, and instructions written in that patient's language. Language and accents also play key roles in completing the communication process. Patients with disabilities who experience communication barriers will require a different approach on how we communicate with them. So you want to use people first language. Offer to shake their hands. And let me back up here. So when I say people first language, if they have let's say they have a caregiver with them, don't speak to the caregiver about the patient if the patient is right next to you. Okay, instead, talk to the patient, and if the caregiver is there, they will offer aids in communication to make sure that the message got through to them. Offer to shake the patient's hands. Just because they have disability doesn't mean that they're not a person. Treat an adult as an adult. Wait until an offer for existence is accepted. So don't assume that a patient with disability needs your help. They have gone through the world so far pretty well without being in the dental office. So if they need your help, they'll ask for it. Be relaxed. Don't seem tense or nervous because the patient has a disability and you have to do extra work or don't know exactly what to do. If they need something, they'll let you know. Take steps to ensure that effective communication strategies are used. Tips for communication with patients who are blind or visually impaired. Once again, speak to the person when you approach him or her. Just because they can't see you doesn't mean that they can't hear that you're talking, that you're not talking to them. Oftentimes, people that lack a certain sense, like vision, their other senses are really attuned to help them get through life. So people that are blind may have uh, really acute hearing capabilities. When speaking in a group, identify yourself and the person to whom you are addressing. Tell the person when you are leaving the area. Okay, you don't want them to suddenly start talking to themselves if you leave. That just makes them embarrassed and it makes for an uncomfortable situation. Do not attempt to lead the person first without first asking. So again, this goes back to don't offer assistance, or don't assume that a patient needs assistance without offering it or having them ask for it first. Be descriptive when giving directions and verbally explain documents. Don't just say sign here. Obviously, they can't see what it is that they're signing. So you want to verbally tell them what it is that they're signing. When you have a patient who is deaf or hard of hearing, you want to gain the person's attention before starting a conversation. Look directly at the individual, face the light, face the light, speak clearly, and use a normal tone of voice. If an individual uses sign language, speak directly to the person, not to the interpreter. If you telephone an individual who is hard of hearing, let the phone ring longer than usual, and then speak clearly when that does ring, when they do answer. Dealing with patients who have mobility impairments, you want to put yourself at their eye level. So if they're in a wheelchair, um, sit down in a chair and even lower the chair a little bit so that you are eye level with them. Also, do not lean on their wheelchair. Do not assume an individual wants to be pushed. That is just rude. Offer assistance if an individual appears to be having difficulty opening a door. That's common sense. And if you telephone the individual, allow the phone to ring longer than usual. If they have a mobility impairment, they might be struggling to get to the phone. So even if it goes to a voicemail, try calling again. They might have just barely gotten to the phone and then they can answer it. Tips for communication with patients with speech impairments: do not pretend that you know what they are saying if you do not know. Ask them to repeat themselves if need be. The communication process may take some time, so be patient with them. Try to ask questions that require short answers or the nod of a head. Do not attempt to finish sentences for that patient. If you have if you are having difficulty understanding the patient, an alternative is to have the patient write his or her response. Most of us have cell phones, so we can even use a cell phone, or the patient's cell phone can type what it is that they're trying to say, and then you guys can use the same phone to type each other. For patients with cognitive abilities, if an area is noisy or has many distractions, you may consider moving to a different location. Be prepared to repeat what you say. Offer assistance in completing forms or understanding written instructions, and provide extra time for decision making. Be patient, flexible, and supportive. For improving communications, the responsibilities of the sender include formulating a message that is clear, concise, and complete. Selecting the proper type of medium, whether it's verbal, nonverbal, or both. Use an appropriate transfer of method like interpersonal or written. Understand the receiver and interpret any possible barriers that may arise. Listen to feedback to ensure the message was received and understood. Responsibilities of the receiver include being a good listener. So this means do not interrupt the sender when they're trying to tell you something. Do not finish their sentences. Do not change to a different subject. Don't show negative nonverbal signs like eyes wandering or the arms crossed. This makes it seem like you're not interested in what it is they're saying. And don't give poor feedback like okay, or that just seems like you're like there are generic responses, and that you didn't really understand or maybe even care what it is they had to say. Also, be sensitive to the sender. Indicate an appropriate medium, and then initiate feedback to make sure that everybody knows that they are on the same page. Developing a positive telephone image can include these qualities. So loudness is the volume of the voice. It is when the volume is either too loud or too soft that a negative impression is formed. So you want to adjust your loudness appropriately. The speed or rate of speech refers to the quickness with which a message is spoken. When the speaker speaks quickly, the receiver may not understand a portion of the message. The pitch or tone refers to the sound of your voice. Those who speak in a low pitch have a deep, gravely voice, whereas those who have a high-pitched voice speak in a high, squeaky tone. Although it may be very difficult to fully change the pitch of your voice, you should be able to control the sound, and developing a pleasing tone in your voice is key. Vocabulary includes proper word usage, which adds to the quality of a message. When patients develop a mental picture of the basis of the words we use, these words or phrases may be very common to the dental profession, but may represent something different to the patient. So then you want to develop a script or an active script. So instead of saying things like, I don't know, you want to say, may I check on that and get back to you. Don't ever say you're wrong. Instead, say, let me try to clarify what it is we're talking about. Don't say, I don't know where she is. Say she's unavailable at this time. Don't say, we can't do that. Instead, say, I'm sorry, but we're unable to do whatever it is that they're asking. We can, however, offer you these options. When answering the phone, you want to answer the phone within 3 rings, sometimes even 2. You don't ever want the patient to think like nobody is attending the phone or we're too busy to attend the phone. Identify the dental practice by name, identify yourself by name, speak clearly and convey a smile, use appropriate terminology, give the caller your full attention. Don't try to multitask or try to check a patient out while you're on the phone. Use good listening skills. Do not place the caller on hold unless absolutely necessary. And if you do have to put them on hold, make sure it's for a very short period of time. People don't like to be put on hold. Thank the caller after the call is finished, and then hang up after the caller does. So the way you want to pick up the phone, it's usually safe to say something similar to, this is Dr. Smith's office, Nancy speaking, or Mike speaking, how may I help you? Or I can help you now, things like that. When placing outgoing telephone calls, you want to first gather all the necessary documents that you'll need to make an effective communication. Plan the call so you will not be interrupted and provide privacy if needed. On a multi-line system, choose an open line before lifting the receiver. Before dialing, check for a dial tone. Just in case you accidentally chose a line that was being used, you never want to start dialing in the middle of somebody else's conversation. Dial the number correctly to avoid embarrassing incorrect phone calls. Know your party's extension. Once connected, identify yourself and the practice and briefly state why you are calling. At the close, summarize the call and verify the call has ended before hanging up. You never want to hang up first when they actually had something else to say. Make sure that there's nothing else they had to say. Let them end the call and then hang up. Other calls include conference calls or video conference calls. These can be useful when trying to get everybody to meet without them needing to be in the same room. For voicemails, when leaving a message, be sure to identify yourself and the dental office, speak slowly and keep the message brief, leave a return phone number, given in a slow, distinct, clear voice, and specify the type of response you want. So for example, the message should go something like this. Hello, this is Derek from Canyon View Dental. I would like to place an order for dental supplies. Please return my call before 5:30 p.m. today. The office number is 909-555-2345. So give the number slowly so that the receiver can write it down as you speak. And then say something like, talk to you later, thanks. And then you can end the call. Personal calls and the use of cell phones are never appropriate during work hours, and especially never appropriate during a patient. If you are a chairside assistant, do not ever bring your cell phone into the operatory. It would be very, very wrong for you to answer your cell phone in the operatory. So it doesn't even need to be with you. Keep it in the back room or the break room or something like that. So from time to time, if you have families, you have kids, you may need to make a personal call. Make sure it's done during your break or during lunch hours. You never want to place personal calls during working hours. All right, that's all I have for chapter 3. Please let me know if you have any questions. Thanks for listening.